Hello, everyone. This is Martin Gerlach from the research team, Wikimedia Research Team. Welcome to our July 2020 Research Showcase. Today, our theme is medical knowledge on Wikipedia, a topic we thought would be especially important to cover given the ongoing situation and pandemic. And for this, we have really two fantastic speakers invited for today. First, we have Denise Smith from McMaster University and Western University in Canada, who will tell us about how different audiences engage with Wikipedia's health content. Second, as a second speaker, we will have Giovanni Colavizza from University of Amsterdam, and he will tell us about how editors keep up with new information from research related to COVID-19. As a quick side note, we will have about 20 minutes for each talk, and after each talk, about 10 minutes for discussions. We are happy to take your questions in the chat or on IRC. Jalal Jifala, my colleague from the research team, will monitor these channels and relay the questions during the Q&A. And with this, Denise, the floor is yours.
Thank you, Martin, for that great introduction. I'm just going to dive right in. So when it comes, let me just get my slide. So when it comes to Wikipedia, we already know that it's the most frequently accessed online resource for health information. Its English language medical content has received more unique page views than any other health information resource online. And we also know that people turn to the internet to look for health information. This was established in a 2013 paper by Dr. James Heilman and Andrew West. But efforts to actually understand with any kind of depth Wikipedia's role in the landscape of health information resources are quite limited. So there were two comprehensive literature reviews of the scholarly publications covering Wikipedia that have been conducted. One focuses on readers and readership, and another looks at Wikipedia's content, but the academic literature and its treatment of Wikipedia as a health information resource hasn't been done yet until now. So the first thing that I found myself asking when I learned this was, how do we reconcile what we know to be true, that Wikipedia's medical content is being used, with what there hasn't really been much consensus about, which is whether it's good enough, how it's best used, in what context it's being viewed, for example. So when Wikipedians advocate to health professionals and experts to contribute to Wikipedia's medical content, right now, the only leverage that we really have that's backed up with hard, solid evidence is that the medical content is being looked at. But we haven't really used the breadth of literature on Wikipedia in this health context to paint a clear picture of all the various contexts in which Wikipedia is employed as a health information source. So that's what I wanted to do. So I decided to do this comprehensive literature review of all the academic health literature that had been published about Wikipedia within any kind of health context. And I was guided by two research questions. The first smaller one was, what publication trends exist, if any, about health-related articles, or sorry, among health-related articles about Wikipedia. And really, I was specifically interested in learning whether these academic articles would be published using the open access publication model, and whether any trends may emerge with respect to how many articles have been published over the course of the years. And then the second research question, which really drove the main goal of my project, was, what does the existing body of literature say about Wikipedia as a health information resource? So you can see it was very broad, and I really cast quite a wide net. So I ended up learning a lot. With respect to the publication trends, I learned two things that were quite interesting. There was a 2018 study that estimated that approximately 28% of all literature is published using the open access publication model. And comparatively, of the 89 articles that I was able to include in my study, 40% were published using that open access model. So even though it's still more common for articles about Wikipedia in this health context to be published in subscription paywalled journals, the complement of open access literature within my review was actually significantly greater than the complement in the overall body of academic literature at large. So I chose to be the optimist and interpret this as an indicator that the authors of those studies, like Wikipedia, value open and broad dissemination of knowledge. And this was really encouraging to me. I also found that there was an overall upward trend in the production of health literature about Wikipedia, and the growth of publications in this field. Again, I chose to interpret that as a promising indicator of the growth of the acceptance of Wikipedia within the academic and health community. And we kind of have a little bit of a double whammy there, because there's already, there's still a stigma attached to Wikipedia within the academic scholarly community, and there's still a stigma attached to Wikipedia within the health community. And so when we have that, when the two merge, it becomes a bit of a sticky point. So those trends were really encouraging for me to see. But the focus of my talk today is going to be primarily on the themes that emerged from the collection of 89 articles that I managed to curate for the study. So I might go into a little bit of detail, but the paper goes into extensive detail and even offers tables that outline which of the 89 articles fell into each of the themes that emerged. So if you're really keen on learning the finer details, I really do encourage you to take a look at that paper in PLOS One if you can. And I did add a link to it at the end of the slide, and you can get my slides online. So 4 major themes that emerged as I engaged with the literature during this review were articles that focused on just plain establishing Wikipedia as a source of health information. Articles that assess the quality of Wikipedia's health and medical content, the utility of Wikipedia's health and medical content in education, and articles that describe the utility of Wikipedia's health and medical content for research. So the articles that fell into that first theme, that situated Wikipedia straight up as a health information resource, are generally quite heavily cited articles that position Wikipedia as a health information resource by using its usage statistics, the superiority of Wikipedia's medical content as compared to non-specific general content in Wikipedia, the ubiquity of Wikipedia's medical content in the results of search engine queries, the sheer magnitude of the medical content in Wikipedia, and the vast number of references to high quality publications in its pages, including really strong representation from some top tier medical journals like the New England Journal of Medicine, Lancet, Nature, BMJ. But by and large, the literature on Wikipedia's health content was dominated by assessments of the quality of its medical pages. And articles of this nature accounted for more than half of the articles I reviewed. And within those assessments, even more context emerged, like subcontexts, if you will. So assessments of Wikipedia's quality were categorized by population of concern to the assessment. There were general information consumers or patients, students, health professionals, and in some of the articles, a specific user group wasn't really clearly identified, even though they were assessing the articles for quality. So in this study, I considered any article a quality assessment if it evaluated readability, accuracy, currency, comprehensiveness, completeness of coverage, or number or quality of references in one or a group of Wikipedia entries. And so with the general consumer or patient in mind, there was a bit of a consensus that Wikipedia is a suitable resource for patients. Interestingly, there was a 2010 study that found that while Wikipedia wasn't necessarily considered to be the superior resource for patients, they still preferred it over others. And this in itself, for me as a librarian, is a gold mine of opportunity for future research. But my biggest critique is that these assessments of suitability for patients do face a degree of irrelevance, because the most recently published report was from 2013, which is now 7 years ago. And most of those evaluations focus on a specific health specialty or issue. So it's not feasible to say, yes, Wikipedia is great for patients, when the little bits that we do know are outdated and focus on specific pages or a specific collection of pages, say about autoimmune disorders, for example. For students, assessments of the quality of Wikipedia's content brought up two salient points. Wikipedia is used regularly by medical students, and we already knew this, and there's absolutely no consensus on its suitability for the population. So some of the articles conclude that Wikipedia is suitable for medical students, others don't. And the findings are entirely contingent on the context of the evaluation. So whether a comparator information source was used, and if so, what Wikipedia was compared to. So some studies base their findings on comparing Wikipedia with other health information sources like a textbook, which really is not an appropriate comparator. With the textbook example, Wikipedia doesn't actually claim to be an equivalent to a textbook for, say, vascular surgery. So you can't really compare its content on vascular surgery to the content in a vascular surgery textbook, because they have two different intended audiences. For professionals, which is again another area where the quality was concerned, and was brought into question, there was really no consensus among the studies. And the same issues with comparisons to inappropriate information sources also came up with this group of studies. And of course, again, like Wikipedia is not going to be as comprehensive as, say, a tool for pharmaceutical medicines. We know, for example, that Wikipedia's medical content, and specifically their content on medicines, intentionally does not summarize information on dosage recommendations out of a concern for public safety. But this is not a concern for, say, the pharmaceutical databases that Wikipedia was compared to, because those databases are proprietary, they're usually locked down, they're subscription-based, and they're intended exclusively for pharmacists to guide their day-to-day practice. So the studies that had no specific audience in mind largely aligned with those that did. So some drew inappropriate comparisons, others focused their comparisons of Wikipedia to other resources, and within this broader context, some did include like-to-like comparisons. So they compared Wikipedia's medical content to open, free, tertiary medical resources. And other studies used a validated instrument. A popular one is called the Discern tool. And that is a tool that's used to determine the quality of online health information. And then there were several studies where this tool was used to evaluate the quality of Wikipedia's content. The biggest challenge for all of English Wikipedia's health content, and this study did limit itself to the medical information on English Wikipedia, is that while it aims to be written in plain, accessible English, the readability of its medical content is often too low to accommodate the very people Wikipedia stands to benefit the most. So the lowest reading level reported is around the 9th grade. And some studies found that Wikipedia's medical content requires at least a college reading level or is considered highly difficult. So other studies simply reported Wikipedia's readability as higher than other health information sources online like WebMD, Medline Plus, or Mayo Clinic. And while there is some evidence to show that this is getting better, and there is a movement among the editing community to improve the readability of Wikipedia's medical content, there's still a lot of work to do to make Wikipedia's health information easy to read for everyone who accesses it. And perhaps the most significant critique I have for these quality assessments is that they wrongly attempt to generalize their findings to generate a holistic evaluation of all of Wikipedia's medical content. And in my opinion, this is futile. it represents a broader misunderstanding of what Wikipedia is. So Wikipedia's articles, we know, are individual pieces of a larger whole, creating a mosaic, you might say, of information where each piece contributes to the summarization of medical knowledge, but where some pieces are more complete than others, and that's fine. That's what Wikipedia is. Wikipedia is also fluid, and while it's prudent to describe Wikipedia as a tertiary information resource, it's not equivalent to a published print encyclopedia. It's not, it's incomplete, and that's okay, and it's dynamic, evolving, and expanding, and that's not something print encyclopedias can do, especially not at the rate that Wikipedia does. So any evaluation of the quality of Wikipedia's medical content, for me, remains merely a snapshot in time that may or may not be applicable by the time the study hits the press. So unless those studies are used to establish a plan to improve the specific content that was evaluated, it was a really significant challenge for me to see the value there. And I didn't see any evidence that those quality assessments were being applied to editing projects, for example. And there might be out there, but I didn't see them. So Wikipedia's utility in education and research. So in education, I considered its utility within the context of different populations, again, ranging from its general usage in educational settings to its deliberate inclusion in course or program curricula, specifically as an educational tool for evidence-based practice or information literacy, and in some cases, it was used for both. And in this study, I actually used the term education to apply to students enrolled in a formal medical or health education program at the graduate or undergraduate level, professionals enrolled in a continuing education program, workshop, or course, and professionals who use Wikipedia to inform their everyday practice. Wikipedia's medical content is reported as an excellent learning tool when students edit Wikipedia for course credit, and there's lots of literature to support the benefits of using Wikipedia's editing as a learning tool. It's also reported as heavily used among students of health and medicine, and again, we kind of already knew that. But as an educational tool for practitioners, its reported utility, and I found this really interesting, was in knowledge sharing between professionals and for daily reference in everyday practice. So for research, with respect to Wikipedia's utility there, again, two contexts emerge, and they both employed Wikipedia's usage data. So for information seeking behavior and bibliometric research, and then as well for health research, namely epidemiology studies. And if you're not familiar with bibliometrics and what that is the study of data about publications. So how many times has it been cited? Who has cited it? How many authors have cross-cited and like cited each other? It's really fascinating stuff if you're a librarian. And it's interesting that Wikipedia has been used for these types of studies. So for bibliometric studies, in the case of Wikipedia's health content, the usage data has been used to assess whether Wikipedia is cited in academic literature and its influence on the popularity of or access to high impact journal articles. There was one study that described Wikipedia as like a gateway to the published health information. And then the epidemiological studies have either used or explored the utility of Wikipedia's daily page view statistics or its raw usage data for estimating things like the burden of disease, to predict possible disease outbreaks, or to monitor seasonal illnesses such as the flu or seasonal affective disorder. And I thought that was a pretty cool way. And I think there is already a small body of literature that talks about disease monitoring through social media. So it's nice that Wikipedia their data is also contributing to that as well. So what does this all mean? Well, it means that with the publication of this review anyway, there is at the absolute bottom line documentation that the literature provides strong evidence to position Wikipedia as a prominent health information resource for the public, patients, students and practitioners who are all using the internet for health information. And we know that Wikipedia is gaining popularity as a tool for education in the classroom, and that there is potential for the usage of Wikipedia's health content to contribute to the study of disease outbreaks. I would like to hope that my critiques of the disproportionate attention paid to the quality of Wikipedia's health content will encourage readers to just stop obsessing over whether Wikipedia is good enough and to just try to make it better, hopefully with a focus on making its medical content easier to read for the average person. And rather than rate the quality of Wikipedia within a specific domain and then recommend its use or discontinuance of use as an information resource, I think these findings could instead be used to as evidence to support advocacy for expert participation in the production of Wikipedia's medical content. Engagement with Wikipedia at the professional and academic level are crucial in order to make it better. And now that I am aware of all the various contexts and how Wikipedia's medical content is used, my intention is to conduct more research into the experiences of the layperson specifically. And I really hope this research will provide more depth in our understanding of why Wikipedia is being used and how it potentially impacts the healthcare and health decisions made by the layperson. Thank you.
Thank you so much, Denise. We have some time for questions. Again, the reminder, if you have to the audience, if you want to ask questions to the speaker, put them in the YouTube chat or on IRC and we will relay them. Are there any questions from the room here? From anyone in the research team?
I put something on IRC that was a discussion point, but I think I can phrase as a question, which is I'm interested in this idea of the quality of the article being contextual. And I think what I'm wondering is to what degree can an article be high quality for all of those parties that you mentioned at once? Is it possible that is a really high quality article that fits all those needs, or would there be something else that would need to be done in order to kind of fit the needs of each of those different parties in the medical space?
Mm-hmm. Yeah, I think that's one of the biggest challenges that Wikipedia faces, is that there really is no defined audience beyond everyone, right? So how do we satisfy the information needs of, say, that clinician who really needs their memory jogged on a specific condition? And how do we balance that and satisfy those needs with someone who's really just received a diagnosis and just wants to be able to read something they can understand about their condition? Or, for example, I read a couple articles about parents of pediatric patients that use Wikipedia as a way to not only understand a diagnosis, but to figure out a way that they can explain it in plain language to their child. And so it's a really difficult task, I think. And what I've been trying to do when I edit Wikipedia's medical content, because I'm not a practitioner and I don't have that medical background, what I try to do is I actually do a lot of copy editing for plain English. And if it doesn't make sense to me, then I have the skills and the access to resources to figure out some like complex terminology, and then I can put it into layman's into like a layperson language. So I would hope that even if we're thorough, and even if Wikipedia's medical content in terms of quality is thorough enough and comprehensive enough to meet the needs of a practitioner, that the language is accessible enough that even a parent or a patient can get what they need from it as well. Does that answer your question?
Yeah, thank you. Can I follow up, Martin? Are there other questions?
I have a follow-up actually on this.
Oh God.
That I was thinking that the readability of Wikipedia articles has been acknowledged in the general context of knowledge, right? And for English, we have this simple English Wikipedia. So it seems to me that serving, if that is kind of not possible to serve, or or increase quality for both doctors and patients, for example, for all audiences, would you recommend, like, would that be one solution you think is worth going, to have like a simple English for medical content?
I don't know. I feel like there's already a very small community of editors who focus specifically on improving the medical content. I would hate to split their voluntary commitment to making it accessible in plain language as well. I mean, there are editors that do that. My own practice is to just improve English Wikipedia and make it a little bit more readable anyway, regardless of whether or not this plain language Wikipedia does exist. And it's interesting that you brought up like the readability of Wikipedia in general, because you're right, like on a general level, most of its content is very readable, it's very accessible, the language is very easy to understand. But the medical information brings a whole host of issues that might not come up, which is there's a lot of very specific medical language out there, and it's very difficult sometimes to use terminology that the layperson might understand. And one thing that I've noticed while editing is that it becomes quite clear to me if I'm reviewing an article, whether or not someone who is a practitioner or an expert has written the content on that article, because they sometimes, as a practitioner, you take for granted the jargon and you don't really see it, right? So as like an outsider, I can go in and say, okay, well, you shouldn't really be you shouldn't be using like this term, we can find a way. Like the one popular one is hypertension, right? Like we can't assume that everyone in the population understands the term hypertension, when you could just easily go in and exchange it for high blood pressure. So that's one thing that I try to do. And I don't really know, I'm not entirely sold on the plain language, the plain English language Wikipedia, because I feel like that's what Wikipedia should be. So why do we need it? Why do we need the plain English to exist in another space?
Okay, I hear there's a few questions from the audience. Gillette?
All right, so I have a question from Jana Ilali, who is asking, what future research do you hope others will pick up?
Ooh, well, I hope they don't pick up mine. What I would really like to see, when it comes to the health content on Wikipedia, there really isn't a lot known outside of the fact that it's really heavily used. So there's like, the area is ripe for investigating specific populations, how they might use Wikipedia. One thing I'm interested in is the difference between active users and passive users of Wikipedia. So those who go to Wikipedia first and like rely quite heavily on it, and those who just passively encounter it when they're doing a Google search, which is, most of the users are accessing Wikipedia from Google. So what makes them choose Wikipedia and over others? And do they look at, we don't know that we only know that they're looking at Wikipedia, and we know that people are looking at, say, Medline Plus, which is, for librarians, the best publicly available resource. And we don't really know how they're using these things in conjunction with each other. Some studies talk about how they're using Wikipedia and then how that affects, say, the patient-physician relationship. But I'd really like to learn more about like what happens after somebody uses Wikipedia, because we don't really know that yet. And it's really hard to say to practitioners and experts, like, please update Wikipedia, like contribute your expertise. We know people are using it, but we have no idea what the impact of that usage is. So I would like to see a lot more studies about that, and like into the people, learning from the people who are actually engaging with Wikipedia, and what using Wikipedia for health and medical information means for them.
Cool. Another question from Keith Bryan, who is asking, well, improving rather than measuring is key. How can you drive professional engagement? Basically, what kind of, can we imagine like tangible rewards for professionals to edit the Wikipedia, or should we essentially encourage and rely solely on altruism?
Yeah, so altruism, obviously, but we can't rely on the altruism of all humans. And particularly with health information, a lot of practitioners and experts lead very busy lives, and it's very hard to convince them to take the time to volunteer, to contribute to the content. One thing that happened at the University of, please don't quote me on this, but I'm pretty sure it was the University of British Columbia in Canada. They changed their requirements for academics in the community for their tenure applications to make it possible for them to include all contributions to knowledge. So what the biggest challenge in academia, say, like, because I work at the university, which is a teaching hospital as well, the biggest thing the biggest excuse we get is, I just don't have the time, nor do I have the incentive, because I have to publish and contribute my time to high quality, top tier medical journals. And what's nice is that this new policy, I believe at UBC, is basically telling academics and professors, to apply for tenureship, you can actually count your contributions to Wikipedia, and you can count your open contributions, either if it's just uploading your data to like an open science repository, for example. Those all count now. And I think if we had that shift worldwide, that would be a really great way to incentivize the people with that expert knowledge to contribute, because now there's a space for it on their application for their proposal. So it's not altruistic, but it gives them a good reason.
Yeah, this sounds like a great idea, and that's one for worldwide and also discipline-wide.
Yeah.
I have another question from Kylie on IRC, who is curious about the coverage. If you looked into the coverage, basically, do you have any reflections on data voids, content holes, biases in topical distributions, etc.? Yeah,
so when it came to the literature that I looked at, it did look at, there were studies that evaluated the quality of some articles based on their coverage, and they did identify, what they were looking for was what's missing from this article that needs to be included. But it was very at an article level. It wasn't like all medical content. And so, I mean, it's a huge population of Wikipedia content. A huge chunk of Wikipedia's content is health and medical knowledge, and it hasn't been looked at, right? It would be great if we could do like a sweeping look at all of the content of Wikipedia's health and medical information and see like what's missing, what biases are in there. We know that like there was that study by Dr. Heilman, quantifying readership, and he does identify there's a bit of a gender disparity, which is common across all of Wikipedia. So that's not news really. But again, like gender disparity, especially when it comes to medical information, then allows for potentially more attention to be paid to some issues and lesser attention to be paid to other issues. One thing that I wouldn't mind doing is actually I've been trying to get the OB/GYN doctors at my hospital to edit like the women's health content, because there's a lot on there there's a lot of pages on women's health content, but it's all like a lot of it, especially the rare conditions, is very poor. And they have the expertise to add to it. So I don't know if that answers your question fully, but at this point, it's not documented like what those coverage gaps are.
I have another question from Jalu. The question is, how does bias in what Wikipedia RSN, reliable resources, has considered a reliable resource impact and how content is written on Wikipedia? Try to rephrase this one. Okay, I'll go to the next one. How can Wikimedia interact with populations that are differently abled to increase its editor base? I think this is a more general question, but if you have some comment on that.
Yeah. I mean, I think the goal is to just be as inclusive as possible. I don't really, I don't really know, like, I don't really have an answer to that because it's really inside the scope of what I know.
Fair enough,
But,
fair enough.
yeah.
Okay.
All right.
I think we
Thank you.
are on time. Thanks so much, Denise, for this nice presentation. And next we'll have Giovanni. If
Yes.
you're ready, you can.
Thank you, Martin. Yeah, I'll get going.
Yes.
Can you see my screen? I suppose so.
Yes. Yes. We can
Okay.
see.
Thank you very much. Thank you, Martin, and thank you everybody for the invitation. I'll speak about work that I've been doing recently on trying to understand what COVID-19 research is actually Wikipedia relying upon. And you may find the full study as a preprint, that link, which is in the slides. And I also have to say it's quite fitting because this is an example of a bibliometric study that Denise aptly defined. So if you want to locate it, that's where it belongs to. And let me start by the motivation for this study. Wikipedia has been, of course, quite understandably, widely used, especially during the most tense weeks of end of March and beginning of April, but also afterwards during the beginning of lockdowns, for people looking for information about COVID-19 in a broader sense. This is I think the daily amount of page views that COVID-19 related articles in Wikipedia have received over time until mid-June. So you can clearly see that there is a spike in between March and April. And behind this user activity, of course, there is perhaps unprecedented, but if not certainly very significant effort of a lot of editors that have been adding new content really on a rush because there was relatively little on Wikipedia before on COVID-19 and coronaviruses before the pandemic, and a lot was had to be added very quickly because indeed users were looking for it. So there has been a lot of activity by many editors, and many new articles have been added in a short amount of time. This is, if you like, the Wikipedia response to COVID-19. On the other hand, we have the research response to COVID-19. So in a kind of similar way, published research on COVID-19 has been booming, essentially. You can see here the year of publication of a corpus of COVID-19 publications, or publications related to COVID-19 that I will define in a moment over time. On the left, you see the whole timeline, and on the right, you see just from the year 2000 to nowadays. And you can pick any one of these two views, and you can clearly see that publications have been growing massively in 2020. So a lot is being published. And at the same time, especially if you look on the left, you can see that publications related to COVID-19 and coronaviruses have started to really take up before, and especially in 2003 and onwards with the SARS outbreak. So also the research response to COVID-19 has been, let's say, abundant. There is a lot out there, and it's very difficult to make sense of it and to find the most interesting information. And then this intersection can be seen from the Wikipedia perspective, because Wikipedia is relying a lot on published research to add new contents. You can see from this plot the number of individual citations to the corpus that I just outlined on COVID-19 literature over months from 2018 to June 2020. And you can see on the right that there is a significant uptake, meaning that editors of Wikipedia have been citing a huge amount of literature in a very short amount of time over the past few months to add new content. And this brings me to the research question that I have. And the question is relatively straightforward, right? So we are essentially both on the research side and also on the Wikipedia side we need to act very quickly. We need to produce meaningful research very rapidly, or we need to add contents to Wikipedia so that people can find them when they need to. And this brings up the question, well, is actually Wikipedia relying on a representative and a reliable sample of this COVID-19 related research? So are we adding contents on Wikipedia looking at the scientific articles that are best suited to provide contents, and also that are reflective of the broad perspective that are already in there in the published research from multiple disciplines, for example? The way to break this question down into two more specific questions is the following. So on the one hand, we have the representativeness of COVID-19 related research from Wikipedia, so cited from Wikipedia. And the way I've approached this question is essentially by clustering COVID-19 publications and taking a look at what is the distribution over these clusters of publications that are cited or not cited from Wikipedia, to see if it is balanced or not. The second question is instead related to reliability. And in particular, we know from previous research, not very abundant, shall I say, on the features of scientific articles that are cited from Wikipedia. And we know that they tend to be highly cited from other scientific literature. They tend to be published in very reputed venues, for example, prestigious journals. They tend to be open access. And the question is then, what are the features of the articles, COVID-19 articles, that are providing contents to Wikipedia? Do they follow the same trends, or do they follow some different trends? So this is more about the reliability and the inclusion criteria of COVID-19 publications in Wikipedia. The data set that I've used needs, of course, to start from this kind of information. So the list of references that we have in most Wikipedia articles that contain, by now, quite high quality, especially for the Wiki project medicine, to say, high quality references to scientific articles that include one or multiple identifiers, such as DOIs or PubMed Central IDs and the like, that we can use to identify those publications. And therefore, I really needed two things. So on the one hand, COVID-19 publications, and for that I used roughly 160,000 articles as of July the 1st from two data sets. One is CORD19, which is maintained by the Semantic Scholar team at the Allen Institute for Artificial Intelligence. And the other one is list of publications, COVID-19 related publications from Dimensions, which is a company belonging to digital science. And of those, 141K actually have a DOI or a PubMed ID that I could match in Dimensions to get their features. So this is the COVID-19 publications dataset that I will refer to from now on. And then on the other hand, I needed citations from Wikipedia to this corpus of COVID-19 publications. And that I got from Avmetrics, which is another company that probably everybody in the room knows, that tracks mentions of scientific literature in different online and social media. And from them, I was able to get citations from Wikipedia of roughly 3,000 of these articles, COVID-19 articles. So this is about 1.9% overall, which breaks down to roughly 2% in English and 0.2% of non-English COVID-19 articles that are cited from Wikipedia. For reference, this is a bit low, because for overall, for all Wikipedia, this number is more on the order of 3.5%, but it's still not too low, right? So meaning that editors were indeed, at least quantitatively, able to keep up and are still able to keep up with this growing amount of literature. Now, let me start with the first question, so representativeness. For this one, I've clustered the corpus of COVID-19 publications in different ways. And I wanted to take a look at the coverage from Wikipedia, so what Wikipedia is citing. And the main way I've done it is using topic modeling, which is a text mining technique that allows to find, let's say, clusters of articles that discuss, broadly speaking, the same topic. And I was able to find at least 5 very broad topics that are represented in this literature. One is very specifically on coronaviruses, and in particular on outbreaks. So here we have SARS, MERS, COVID-19, for example. Then we have literature on epidemics and modeling of epidemiological spread and the like. Public health is quite prominent, and that deals with anything from testing to hospitalization and the like. Molecular biology and immunology is instead more focused on vaccines, for example. And then clinical medicine is instead literature that deals with hospitalization. So let's say after someone has been hospitalized due to COVID-19, what can we do for them? And you can see from this timeline, so this is the relative average topic intensity over time. Okay, so it's not absolute. In absolute numbers, everything grows, right? So the literature is always growing, especially in 2020, but even before, for all topics. But in relative numbers, we see that there is really a transition in 2003. And this is the SARS outbreak, when very significant and also dating back quite a bit, corpus of literature on molecular biology and immunology also gave way to other topics because, of course, there was an ongoing epidemic. So we have epidemics, coronaviruses, and public health that come up and also stay up. And another big transition we can see in 2020, right, with especially literature on specifically coronaviruses and public health is going up quite a lot. And then we can also see, well, what of this literature is cited from Wikipedia. And in particular, we can take a look at what is the distribution over this topic of articles that are cited from Wikipedia and those that are not cited from Wikipedia. And this is the distribution overall. So over the whole corpus, what is the average topic intensity that we have? In green, for articles that are cited from Wikipedia, and in blue for those that are not. And you can see that roughly the situation is pretty good, pretty balanced. So we have some over or under representations. For example, we have more molecular biology and immunology and less clinical medicine, but the picture is relatively balanced. If we break it down in 2 ways, so before 2020 and in 2020, the picture is as follows. So we have something roughly similar. We have much less coronaviruses, and we have much more or quite more molecular biology and immunology, but also epidemics. Clinical medicine is still pretty low. If we take a look instead at 2020, we see that public health has been growing quite a lot in general, as we have seen, but less than proportionally in terms of being cited from Wikipedia. Instead, Wikipedia editors have focused much more on coronavirus-specific literature. So this is literature that contains, for example, discussion about localization of epidemics, right? So, and also literature that is not specifically about medicine, but also contextual, for example, from social sciences. This has gone up quite a bit. But still, overall, the picture is quite balanced. So also the significant testing is pointing out that the size effects are not very high, not very broad. And in particular for coronavirus-specific research, the picture is quite balanced. But still, differences persist, right? So over these topics. So we move then to the second question, which is, in a sense, reliability, or maybe a better way to say it is inclusion criteria. So what are the features of articles that make it into Wikipedia? So they are cited from Wikipedia. The main question that I had was, well, first, can we see the same inclusion criteria that we saw before and in general for Wikipedia? So for example, being highly cited, being highly impactful in terms of citations. And the second point is, can we still see an effect of the topics when we control for article level effects, right? So when we control for features that belong to the article, do we still see significant differences in terms of the distribution of the topics between cited and non-cited? And for this, I've used regression analysis in particular, where we can just focus on a model which is logistic regression. So what we try to predict is this article cited at least once in Wikipedia or not? And the results are pretty encouraging, at least from the perspective of the editors, I suppose, in that pretty much the same inclusion criteria that we have in general for Wikipedia are respected. So articles tend to be published in specialized or reputed journals such as Nature, BMJ, or The Lancet. We also see that received citations from scientific literature is a strong positive predictor, as well as other metrics, by the way. This is a bit new. So articles that are highly mentioned on Twitter, they have a lot of Mendeley readers, or they are very mentioned in the news, for example. This is also a positive indicator for them being cited in Wikipedia. We also see that preprints usually don't make the cut, such as medRxiv or bioRxiv. And then finally, and for me particularly important, is that no topic is predictive. So there is no significant correlation with respect to any topic, meaning that when we control for these article level effects, we filter out any leftover or residual variation in terms of the distribution of the topics over the topics that I have discussed before, which I think is good news because it means that the inclusion criteria are quite good, and at the same time, there is a balanced representation of the topics that are discussed in the literature. Yeah, this is the good news part. So to conclude, essentially, we saw that the editors, well, did an amazing job, I have to say, because the effort was really large scale and very rapid. And the editors are still able to integrate new literature at an amazing pace. The coverage is pretty good. It is not perfectly balanced, but when we control for article level effects, it is. And also the inclusion criteria, they respect, let's say, what editors tend to do for other pages in Wikipedia and when we are not doing a pandemic. So the last message is really well done, editors. I think it's really, really good news. And that's all for me. Thank you.
Thank you, Giovanni. Thanks for the talk. Again, we have some time for questions. And I will start in the room if there's anything here.
Okay, then I will kick off with some questions from the chat. So basically, Jaru is asking, how does the community response in editing COVID-19 compare with the editing pattern in the past, specifically for bird flu, swine flu, Ebola, and other outbreaks? If you have some information about that.
Yeah, this is a good question. So I don't really know much, honestly. So I know a bit about COVID-19, but I'm no expert about these other situations. I think this is really something that I would like to look for in the close future. What happened for COVID-19, and please, anyone that has better knowledge than me, jump in. But what I know is that after, let's say, a few days or weeks of hectic and free-for-all editing, all the contents related to COVID-19 have been, let's say, protected. So only users with at least a few days of activity in Wikipedia, or I think a few edits possibly, done in Wikipedia could edit those pages. And the team, the group of editors from the Wikipedia project, Medicine, really jumped in big time, and they led the effort. So there was a little bit of restriction in terms of who could edit those pages. And I think those restrictions are still in place at the moment, but I haven't checked in the past 1.5 months. And by the way, I mean, the editors, the core community of the editors in the Wikimedia Medicine project, and Denise, maybe you know better than me, they are experts. I mean, they're really good.
The other question is about the disparity of COVID-19, maybe specifically coverage between the global north and the global south. Did you observe sort of kind of different edit patterns between kind of geographical areas in the world?
Yeah, so the only information that I have about that, or that I focus on about that, is that of language, because I haven't yet focused on the editor specifically, nor on. I mean, I've included all Wikipedia pages, but the corpus of literature that I've used is unfortunately quite biased on English. And the reason for that is that they collected it using keyword search in English, which is unfortunate, I mean, to some extent understandable, but unfortunate, meaning that most of the study really focuses on Wikipedia English, not necessarily because other Wikipedias are not citing this literature and the like, but because the corpus of COVID-19 related research that I used is biased in that sense. So I don't feel like say anything yet about this, because I think it needs to be, the study needs to be expanded, starting from the corpus of COVID-19 literature and then moving to other Wikipedias.
Cool. The other question is about what can we learn already so that we can, as a community, be better prepared for a pandemic like that in the future?
Yeah. Well, maybe a couple of things. So one is really not, I don't think it's a responsibility of the editors, but what we really found in general in research community is that we are really ill prepared to, well, let's say we use still quite rudimentary means to search, sort, and organize the scientific literature. And what we really rely on, most of us, are citation indexes, take Google Scholar, for example, and Twitter. So the network of colleagues and peers, which is fine to some extent if you are really embedded, but it is also quite limited, especially if you suddenly are connected to a topic that is much broader and goes much beyond your community of peers. And a lot of initiatives have been about, and I hope they stick or something emerges, about building better search engines and systems that allow to perform, to search through the literature in a more powerful way than just using citations. So this is one thing that is for researchers to do, or companies. The other bit for the editors, I think that having an editor community of engaged experts that are there and are ready to act has proven to be a very valuable asset. So I think that I'm not sure that they would have been able to do the same effort with such high quality and speed without being already a cohesive community that can work together.
Thank you. Are there any more questions?
I have a general question, maybe for both Giovanni and Denise. I know it's not kind of directly bound to your presentations, but do you have any thoughts on how we can fight disinformation specifically within the scope of medical content? Anything that you observed in your research? Yeah.
Education. Education is like one of the things that we're focusing on right now in the curriculum in the Bachelor of Health Sciences program at McMaster is teaching students how to trace quoted studies back to their original source to either find A, whether or not they exist in the first place, and B, if they're reputable. And then they have to use their critical thinking skills to determine whether or not that study is even credible, or was it a study based on 20 people or 1,000 or 1 million. So education is key, and the problem with that is access, right? There's a lot of people that don't have access to learning those kinds of skills. So we need to find a way to educate the public en masse about how to be critical about the misinformation that's being broadcast to their social media streams, and even through what might be considered reputable news sources. Headline sensationalism, it's a big problem, and I think the only way we can really combat it is just by trying to provide open and free access to as much education about critical appraisal of news and news sources and information, as much of that as we can. So it sounds a bit idealistic, but it's really the best answer, I think.
So maybe quickly, the best answer is taken, so I'll go for the second best answer. I also think it's important to recognize the role of expertise and experts, and which is, I think, something that emerges a lot with the editor community behind these Wikipedia pages and medicine project. In the sense that we have seen, especially in this kind of global crisis, that everybody's attention is focused on them. And also as researchers, for example, we start doing research on that, etc. But that should not, I believe, mean that everybody in research, even starting from us, should do anything, and anything goes, right? So we should still try to focus on what is our expertise and what we can actually meaningfully contribute. Instead of overstepping, and listen to the others and collaborate where we don't have the expertise.
Cool, thank you. That's all I have from my side and from the chat. So thank you very much again.
Great. I think these are good words. It's a good note to end this showcase. That was really, really interesting. Thanks to Denise and Giovanni for the 2 presentations. Thanks for Gilles to take the questions. Thanks for Emerald Ross for the AV support, and Jana Layton for coordination support. And thanks to everyone who watched, who listened, and who asked questions and engaged in this discussion. And with this, I hope to see you around for the next showcase in August. Thank you. Have a wonderful day.